Hello, everybody. I will just share my screen here. So I will just go through some updates, some new information, and then try to leave quite a bit of time for questions and answers, because I'm sure with a few weeks apart from each other, there are probably a few. So I just wanted to review sports a bit. Really right now, other than skiing, there should not be any sports or any practices. There is a pilot program going on right now that involves only the postseason competition games for volleyball, swimming, and football. You should know if you are included in that, and should already have had several meetings with MDHHS about it, and it involves rapid antigen testing. So if you're not part of that, there should not be anything else going on. That is stated in the current epidemic order that pre-K through the 12th grade, anything that involves physical contact, high degree of exhalation, or physical exertion indoors, or anything where masks cannot be worn, are not allowed. So basically that's their way of saying all sports except for skiing. I know that sometimes communication is challenging. I know the High School Athletic Association has said that under the current orders, practices can start on January 16th. Basically, this current order ends at midnight on the 15th. We have no indication at this time that on the 16th, anything regarding sports will change. We don't know what's going to happen on the 16th. So just so you're aware, on January 16th, things may not be any different. We don't know. We honestly do not know at this time. So just so you're aware, because we know that there's a lot of announcements going out and school discussions about, basketball will start on the 16th, things like that. There's no guarantee that's going to happen. So we just want you to be fully aware of that. This is an updated report that I think is really well written and has a lot of good information. This report had been put out earlier in the summer. It's put out through Harvard, but basically, they had indices and metrics and all kinds of different recommendations. Now they're saying that schools can be open even at the very highest level of spread, as long as you have prevention strategies and infection control, which they describe as universal masking, hygiene, good air exchange, distancing of at least 3 feet for young learners, 6 feet for older kids. When the rates are at a significant level, good quarantine policies and contact tracing, and where it's feasible, consideration of screening, testing, and surveillance testing. I did put the link on here. This is also a new reference in the Massachusetts General has a library of references for schools that I've talked about before. So this was one of their newer references that they added in. Another new reference that they had was here. It's a study about mobile air purifiers in school classrooms. I'm sharing this not because I'm saying you need to all go out and get HEPA filters, but I just wanted to share this study. They had 4 HEPA filters in a classroom, so creating about 6 air exchanges an hour, and found that it decreased the risk of infection if you were to have a highly infectious person in that room by about 6-fold. So again, just another interesting study that's out there if you want to take a look at it. Just trying to share what is out there. Given the new rapid antigen testing that's going on with sports, I just wanted to share as well some of the limitations with rapid antigen testing. It is a useful tool, but it is just one tool and it does have some limitations. We just want to make sure people are aware of. This is a study that came out from a large university setting where they're using rapid antigen testing. So people that had symptoms, 1 out of 5 of them that tested negative had a false negative result. Just to have more specific data here, I know this is a lot of numbers, but basically those that were screened that were asymptomatic. So like in our sports pilot right now, if you're screening people that are not symptomatic, those that are positive, only about 1/3 of them are actually a true positive. So needing to confirm that with a PCR test is really important. And those that are symptomatic, if they have a positive test, it is pretty predictive. So just showing that, again, if you have a negative test, though, there can be some false negatives. So we need to confirm that with a PCR test. So I put here the positive and negative predictive value, sensitivity and specificity of PCR test, because it's kind of the gold standard. So you could compare and contrast how well the rapid antigen test does compare. But again, not saying that we can't use that testing, but just want to point out that there are some limitations. If you're doing mass testing, you know, just because everyone's negative doesn't mean they can all congregate together, things like that. I wanted to cover the variant strains that are occurring because we figured that you might have questions about those. I do have a lot of information in here. I will cover it quickly, though. We'll have this for reference. So the SARS-CoV-2 virus is an RNA virus. They do tend to change, mutate with time. Most of the time, those mutations don't really affect how it functions or affect how medications would work or vaccines would work, but some of them do allow it to spread faster or infect people more easily. Some of those changes are more major, and those are called variant strains, and they're usually given some kind of a name. We find them because all across the world, labs are doing random whole genome sequencing on just a random selection of samples. And when they notice something unusual happening, like in England, when they were noticing an unusual increase in cases, they think, why is this happening? And they do a bit more genetic testing. So just out of interest, in the US, these are locations where that genetic testing is being done. Michigan has at least 2, well, actually, the state lab does quite a bit of genetic testing. U of M does it as well, and we have other university labs that do it too. So 6% of the genetic testing for COVID is occurring in Michigan. So we do a lot of genetic testing for a lot of different pathogens. So we actually have a really good public health lab. So when you have a variant strain, there's different concerns. One is you worry, could it spread more quickly because maybe it binds to its receptor better? Could it maybe cause more mild or more severe illness? Right now, the variants don't seem to be doing that. Could it perhaps have changed enough so that the sites that are detected by the tests are no longer going to be detected by the tests? That doesn't really seem to be an issue because our diagnostic tests pick up several different sites. There's always a possibility that some of our treatments, specifically like monoclonal antibodies, which are specific to one site, might not work anymore because that site could change. And then also the ability for your natural immunity, if you had a previous infection or vaccine-induced immunity, might not work anymore. So far, that's not really felt to be a concern in any of the variants that have occurred because really it's a small proportion of the whole spike protein that has changed, and we're getting immunity to the entire spike protein, and our body will create antibodies to multiple different sites on that. So we're not really worried about that. So just variants of note, there's one called cluster 5 that caused, if you recall, hearing about a bunch of minks having to be put down in Denmark. That was a strain that caused those poor minks to get infected in Denmark. Then the one that's being called B117 is the one most recently found in the United Kingdom and has been found in at least 31 other countries, including the US. It does seem to spread a bit more quickly. It does bind to the ACE receptor a bit more strongly, but right now we don't think it is going to impact vaccine effectiveness. Then there's another one called B1351, which has been found in South Africa and at least 4 other countries. We haven't found it yet in the US, and we're still learning more about that. It may spread more easily. It doesn't really look like it's any more severe. Same with the B117. And again, neither of these seem to have less effectiveness with the vaccine, but they actually do have targeted studies going on to prove that. So just so you know a bit about the variants. To talk about vaccine scheduling, first of all, we just ask that you be patient with us. Some of this accelerated movement has been a pretty sudden change for us, and our availability to vaccine is still in process. So we are moving as fast as humanly possible. So we'll start with that. For Central, if you're in the 6 counties of Central Michigan District Health Department, if no one has been in communication with you yet, you can go to our website. On the front page, the home page, there are different tabs you can select from. You can click on, if you want to work on behalf of your entire school, click on the Essential Critical Business tab. If you want to have maybe like your contracted workers or others set up appointments just for themselves, they can click on Essential Workers, and you'll provide some information, and then we'll be in contact with you to set you up for clinics as we get them scheduled. If you're in the 3 counties of Mid-Michigan District Health Department, if no one has reached out to you yet, which again, for both of these, likelihood is that someone has or will be getting a hold of you. Again, you can go to our vaccine website. There's a statement in red that says if you are a business or agency in the 1B category, there's a link you can click on to fill out. If it's an individual that needs to register for a vaccine, there's a link. It's kind of hard to see here, but there's links down for each county they can fill out. Right now, all our appointments are full because, again, we have limited vaccine, but we will be getting more so they can continue to check. And then with District 10, you all should have gotten an email that was sent out yesterday, but tomorrow, if you have ISD staff that is working with, face-to-face with students and essentially, kind of operating in like a healthcare worker type of a setting in your ISD, we do have openings tomorrow and we can vaccinate them. There was a link sent in that email. I've included them again on here. These slides will be posted on our website later today. If not later today, then early tomorrow. We're also working on plans to get vaccination clinics set up for the K through 12. And we'll be letting you know all that as soon as humanly possible. You can also sign up at dhd10.org/subscribe, and you'll get updates with all of our vaccination plans as well. All of our websites are likely running slow because we've had a lot of traffic because of the vaccination changes. We're getting an insane amount of phone calls, so we ask as much as possible. Email if you have questions. Try not to call because everyone's trying to plan vaccination clinics, and again, we're getting just a lot of phone calls. Just a reminder, I still do have in the plans to put out a joint press release encouraging vaccination as a way to help keep schools in person and kids and teachers safe. My plan is to target it more to mid to late January, since right now we're not hurting for people who want to be vaccinated. I do have, I have saved all the names of the schools that would like to be a part of that joint press release. So if any others are interested in supporting that idea, once I have that draft written, I will share it with you to approve it. We would never put that out without your approval. So if anyone wants to support that message or consider it, just let me know, and we'll include you in that planning process. So the quarantine changes, just as a reminder, you can reduce quarantine to 10 days after starting the day after you were last exposed to someone contagious, if the individual can continue to monitor for symptoms for the full 14 days. 14 days of quarantine is still an acceptable option if you prefer to do that. Previously, you may recall that Public Act 238 had in writing that employers had to have their employees on a 14-day quarantine. That has been officially amended, and the governor did sign it on the 29th of December. So that has officially changed, and that is available if you just Google Michigan Senate Bill number 1258. You will see the wording of that. It officially defines quarantine period as the recommended number of days that an individual be in quarantine after the individual is in close contact as prescribed in the US CDC guidelines. So there is no defined number now in that. It just says as defined. There are numerous other improvements in that. It was kind of hard to put all of them into this presentation today, so I do encourage you to go to that and read it, because it will affect some of the things that you do and don't have to do with your employees. Just some data that was presented on the state website by our head epidemiologist for the state.
Is there a way you can, I mean, do you ever run across this path?
No. So just statewide, the percent positivity for testing, as you can see, back in November, we got close to 15% positivity. We got down to a low of 8.2%, and things have been increasing a little bit after the holidays. Our cases per million have been steadily decreasing, and the daily hospitalization rate has decreased a bit and has kind of been plateauing. Of note, we really have not been seeing influenza activity yet at this point. So just a little bit bigger graph, our daily confirmed cases that have been reported to the state. We hit a low here before the end of the year, and things have bumped up just a little bit. We're right at that 7 days after the new year. Most cases of COVID become symptomatic at 5 days. Up to 14 days is kind of the max. So we're almost out of the woods in terms of that post-New Year's rush of cases that we would expect. So we did see a little bump, but not tremendous in terms of that. I just wanted to show some examples. So here's Michigan at the top. Here's our big spike. Note that this top bar is 10,000 cases and the deaths are 200. So we did spike, we went down, and we're bumping up a little bit. The entire US is down here, so no drop happening. Ohio is here to the left. And again, they really did not have anywhere near as big of a drop as us. Arizona looks like they didn't have that many, but this top bar for them is 15,000. So their numbers are about the same. And then Florida, their top bar is 15,000. So they have just continued to climb and climb. So I just wanted to show for example, throw up a few other states for comparison, just to show how Michigan has been doing. Here's our percent positivity This was on the left, the first through fifth. That was the last time that we talked. This is how our percent positivity looked. And then on the right was the last week of December. Most of our counties are in single digits now, whereas before they were almost all in double digits. We still have kind of a strip here right in the middle of the mitten that is just over 10%. And but the counties here that have been historically higher have been creeping down. So I have more specific numbers for you later. Here's our outbreaks. Again, this is the last week of December. So there wouldn't have been school most likely for a week. So there were two new school outbreaks, 76 ongoing school outbreaks. And when they break them down in terms of the number of actual cases of people sick, there were 15 new people involved in school outbreaks. 0 high school, 0 middle school, 14 elementary, and 1 administrative. So, I wouldn't really expect high numbers, again, given that it was near the end of the year and into the Christmas break. But that's a good sign going into this new year. Hospitalization rates, our regions are 6, 7, 3, and 1. So 6, 7, 1, and 3. So everyone has been trending down or staying pretty stable. In terms of investigations, this is the end part of the year, and this is the beginning of kind of the last bit of December, early part of January. We're getting statewide to about 40 to 50% of our case investigations, completely investigating them. Many of them are partially investigated. About 40% of people, when investigated, know where they got exposed at or who exposed them. And a quarter of people are already in quarantine, which is a good sign. In terms of how your area is doing on case investigation and contact tracing, I'd encourage you to communicate with your point of contact at your county health department by email, if that's something that you would need to know if you're making decisions about what to do with your school status. Turnaround time for testing. Most people have their testing done by a local hospital lab, and that's about a 2-day turnaround. In terms of, you get it collected at an urgent care, it goes to you have to transport it to the hospital, and then about a day and a quarter to actually run it. Commercial labs would be if your urgent care mailed it off to like Mayo Lab or Quest Lab. So that's taking around 4 to 4.5 days. So lab turnaround time is much better than it was the last time we talked. So in terms of our data, I think I'm sharing my screen in a way that you all can see, so let me know if you can't. One good thing I'll let you know, we have different colors on the screen again. I was able to use the lighter purple again on some of these lines. So we have some counties that have gone from highest risk to very high risk. So that's an odd thing to get excited about, but I am excited about that. So in terms of Michigan, these numbers here from last report, again, was that last week we talked, the daily cases per million are half of what they were, and the percent positivity went from 11.5 to 9.5, essentially. For Central, same, pretty much the same. The percent positivity is similar, so we are seeing a little bit higher percent positivity there. I know some areas are still really struggling with nursing home outbreaks and assisted living outbreaks. And so some of that may skew our results a bit. Same with District 10. We have quite a few that have gone down below that line, including Mecosta, which, they had historically been very high because of Ferris. But they went from 406 cases per million to 175, and they went from 12.8% to 8.6%. So again, we'll share this table with you, but these trends here are how many days in a row have these numbers gone down. So some of these counties, so like Kalkaska County has had a downward trend for 55 days straight. And then they reported a little differently here for percent positivity. Using
Jennifer,
Kalkaska still.
we can't see your screen. We can't see your screen.
You still can't see my screen?
You stopped sharing your screen. Looks like you stopped sharing.
Did that fix it?
Yes.
Okay.
Can you hear me okay?
All right. So I was just showing how with Kalkaska, just using that as an example. So this minus 55 means that their daily cases per million have been decreasing for 55 days, and their percent positivity has been going down for 2 weeks. And then further south we go, our numbers tend to be higher. That's just how it is. And they still, though, have seen a significant drop in mid-Michigan. They went from 554 on average per million to 248, and the percent positivity went from 8.6 to 7.6. And again, consistently been dropping for over a month to almost 2 months in the case of Gratiot County. So again, we'll share this table with everyone, and this is all taken from mystartmap.info, just pulled together for you. Then I will. We did have some emails, some questions emailed to us ahead of time, so I'll just address those now, and then we'll get to everybody else's questions. One was, if a person tested positive for COVID in the fall and recently started having a runny nose and sniffles, do they need to get tested again and quarantined, or can they work? So if a person has been infected before and it's been over 3 months since their last illness started, or since the date of their test if they didn't have any symptoms before. So if it's over 3 months, they should be tested again. This is copy and pasted from the CDC. I did add a note there that, one concern with repeat PCR testing is that it stays positive a really long time. Rapid antigen testing tends to only stay positive for about 7 days after you're sick. So that would be one option if there is a concern about that. So if you have that available in your area, that would be an option if you're worried about getting a false positive PCR test. Another note on that is that on the employee screener that we have provided, and also this comes from the screener that the state uses. The recommendation with that is that you use one of the following symptoms: fever, cough, or shortness of breath, or 2 of the following: muscle aches, chills, sore throat, headache, vomiting or diarrhea, loss of taste or smell. Not included on those symptoms is runny nose or stuffy nose. So in this scenario, this person would not be advised to get tested. However, we know that with the Senate bill symptoms and the CDC symptoms, and there's different there's many different obligations or concerns. So, but long story short, if someone has symptoms consistent with COVID-19 and it's over 3 months, then it is recommended they get evaluated again. I heard someone at another health department that recommended if you have had COVID in the last 90 days, they should not sign up to get the vaccine right now, but wait for others who haven't had COVID to get vaccinated first. Is this what is recommended? Not really. That's not really recommended anywhere. The recommendation is that because reinfection is uncommon in the 90 days after initial infection, those that have had a confirmed COVID infection in the prior 90 days may delay their vaccination if they want to. So it's kind of your choice. I would not tell somebody you should wait 90 days and let somebody else go just because I don't really know for a fact, what reinfection rates are like. If you're currently infected, you should wait to get vaccinated until you're until your acute symptoms are better and your isolation period is over. But the waiting for 90 days is your option, really. There's no medical recommendation for that. If an employee displays a principal symptom of COVID, the amended statute, which we were just talking about, says that the employee shall not report to work until they either have a negative test or they have fulfilled the full isolation period. And so the question is that consistent with or supported by the health department at this time? So this is legally allowable now, and employers can follow that guidance. The recommendation of the CDC is still that sick employees should follow prevention recommendations and should not return to work until they've met the criteria. I copied and pasted this just an hour ago. So they shouldn't return to work until they've met the criteria to discontinue isolation guidelines. So I have a hard time saying, so basically you can follow that guidance, but the CDC says this. So it's hard for me to say either way, but yes, you can follow that guidance, which I believe, we've talked about before that you could until that bill came about. So at this point, we can open it up to additional questions.
Okay, Dr. Morse, can you hear me okay?
Yeah, you're a little choppy, so if you want, I can go through and read the questions if you have signal issues.
Okay. Yep, that sounds good.
Okay, let me just get to the top. Okay, I think the first one is from Cheryl. What is the recommendation for quarantine? So I think we covered that. The 10 days is acceptable. Is there any new knowledge on how long the vaccines last within the body? No, that will take time. What about DHD-10? Oh, we went over that. Can you explain 11, 12, 13 in the survey? So I'm assuming someone's talking about the survey to get vaccinated, and I don't know which health department survey you're talking about.
Dr. Morse, if I may, it's Sean Petrie from Core ISD. So thank you for taking the question. It's in regards to when we go on for essential workers. There's questions down there about whether or not we put in a submitted paperwork to become a site for vaccinations, and just some just asking about those three to make sure when I say yes or no to each of those, kind of what they're asking for. That's all. I mean, it can be done differently at a different time, but I just wanted to ask the question. Thank you.
Okay. So I don't know if we have anybody from that health department that can answer that, because I'm not that intimately involved with the process.
And that was Central Michigan's survey that came out from.
Okay. So I know some of the nurses have been in contact with the schools about, whether or not they want to do vaccinations at the schools. And, you would have, so if you've not turned in paperwork to somebody to be a vaccination site, then, and if you're not sure, just leave it blank, because someone will call you back to set things up.
Thank you. That was my assumption. I just wanted to kind of
Yeah.
get some clarification.
My hunch is that all of our vaccine people are not able to be on the call today because they're vaccinating people. All right. Should a person who has had confirmed case of COVID within the past 90 days receive the vaccine? So we just discussed that. If my district crosses counties, how should I share my employee data? If either DHD-10 or CMDHD comes on site, that impacts where my people are willing to get the vaccine. So all of our data goes into a state registry. So if I got vaccinated in Detroit, then my doctor in wherever would be able to know everything I had done. So it wouldn't matter what health department you got vaccinated by. The county that your school is in would be the one vaccinating you, but your employees can go wherever they want. So basically, whoever vaccinates your employees, it shouldn't matter. So, and then it's called MICR. And then everybody's healthcare provider has access to that. Pharmacies have access to that. So the ER has access to that. So, so again, no matter who gives them their shot, everybody who needs to know about it will be able to know about it.
Dr. Morse,
Yeah.
what I'm kind of wondering is the data that I'm collecting for my employees, I have received it from both CMHD and DHD-10. So I have it, but I'm trying to figure out, do I just share it with both? And knowing that some people indicate they want to go to Macasta side, some people want to go to Isabella side, let you decipher it after you get it. I just don't want to share what you don't need.
Oh, do you mean in terms of how many people want to get vaccinated? Is that the information you're
That's
talking
correct.
about?
Yeah, I have a list
Okay.
of all my employees, who wants to get vaccinated and in what county
Okay.
they would prefer if they have to go. Now, if it's on site, then that makes it easier. But if it's off site,
So
they would go wherever they so choose.
I don't know the answer to that. I don't know if we have an Isabella or a Macasta County person on the phone, or on the call.
Doc,
Yeah.
Doc, this is Kelly Conley, and I can answer really quickly to the other question about the critical infrastructure. You can skip questions 11, 12, 13 if you're not. Some healthcare providers also may become COVID providers, and that's what the paperwork's referring to. So if you mark schools and do that survey or the third link, either one, we're going to get your information and put you on the correct list for schools. So there's no paperwork that you need to do. But as far as we are actually using responses from each school, if you're going or you're coming to a health department location in like Isabella County or Osceola County for Central Michigan, we're basing our doses based on the response we get. So just don't count them twice if we're not coming to your school, because we are we have to know how many doses we provided this week and report that to the state. And our ordering approvals are based on how many doses we plan to give also next week. So if you do have people that you think would potentially, say you have 100 staff and 50 may go to Central Michigan and 50 may go to District Health Department 10, just report 50 to each.
Okay, which is fine, except if you guys come on site, probably all 100 would get it here.
That's
That's
fine.
what I
Just
don't know.
just work with the one health department, probably the health department that is in the county where that school resides. So just depending on the school location, since you're crossing county lines, whether it's Central or District 10, whichever plans to come to your location, that's the ones that is the agency that will order the vaccine for that site.
So if I have schools that are in different counties, do I go by the school building? For example, Wademan's in Isabella. Do I just handle Wademan population and share it with you guys? And then the other ones I share with DHD 10 because they're in Mecosta side. That's what I'm trying to figure out. I'm just trying to make it most convenient.
So
Yep, go ahead.
I would say, Kelly, Bob, talk to Mecosta County and just see how they would like to handle it and then go from there. I think that would probably be the easiest.
Yep, and we can do that county, or if you want someone else to do all your schools or they are planning that, we can coordinate it with them too as soon as you talk to them.
Okay, sounds good. Thank you.
Dr. Morris, this is Kevin. Sorry, I was tied up on another call. Yeah, just go, if they're going to send it to us, go ahead and we'll get it taken care of.
I will send that over today, Kevin. Thank you very much.
Okay. So the next couple have to do with the ISD for District 10. So the email about vaccinating ISD frontline staff likely just went to the ISD, which that makes sense. And then the question is, where was that happening? And so that's integrated into the clinics that District 10 is already doing. So talk with, those emails went to, I believe, the superintendents for the ISD, and they can sign the school up. I know Sarah Olenichek sent that out from District 10. I don't know if there's any further information anyone from District 10 wants to share about that. That's all. She just shared the email with me. So, but I would just,
For those,
go ahead.
I was just going to say, I mean, we do have clinics in all of our counties tomorrow. So I'm not sure what was in that email, if there was the registration link in there. That can be shared. Those individuals who would fall into that category can register to get signed up, or we will have clinics that'll be starting next week. And then we'll be working to get additional clinics set up and getting in the rest of the schools.
Hello.
Yep.
This is Trina Scott from the Wexford Misaki ISD. And I work with Dave Cox. He's our superintendent. And today we did send an email out to the staff that we felt we did email Sarah and kind of got a confirmation of the staff that we should be sending that email out to. So that did get sent out this morning to our special services and special education staff and itinerants. And they had the link to go in and to be able to register. Today, this morning, we sent that out to them. So hopefully they are aware of that. And we had our supervisors and our director kind of helping assist with getting that communication out to them as well. So we were assuming that probably Wexford health department, as well as the one in Lake City, would be available for for that clinic for the vaccine. Is that correct?
Yep.
Tina, I think it's important to understand, though, that these are not walk-in clinics.
Mm-hmm.
These are scheduled clinics. So you need to make sure that your staff schedules an appointment at one or the other of those clinics.
Yes, we did specify that they needed to fill out their registration form prior to doing anything else, and that they would have to, according to the email that was released to us, that they would fill out that link, that registration form with the link, and they would provide their phone number so that somebody from the health department would be able to call them back to set up that appointment. Is that correct?
That's correct. That's the process. Yep, that's
Okay.
correct.
Good.
Thank
Okay.
you.
Thank you very much. We appreciate that.
Good. And then regarding the other question about, because there was another question on here about it from someone else from an ISD. If there's questions, again, your superintendent should have gotten that email, so I'd follow up with them. All right. So there was a question, it may have been before I talked about vaccination, but the time frame to wait to get after you've tested positive and when you get the vaccine. If you're positive and asymptomatic, just wait till your isolation period is over. If you have symptoms, wait till your isolation period is over. And also once all your more severe symptoms are over. If a person has received both doses of the vaccine, do they still need to wear a mask? Yes, they do. At this time, and that's a really important point, as your employees are getting vaccinated, everything else stays the same. If they have symptoms, they have to get tested and isolate. If they are exposed, they still have to quarantine. You still need to wear your mask. You still need to do everything else the same until we get enough people vaccinated, until we know how our control on the virus is doing, then we can start to back off. But if we add in vaccination and then just stop everything else, we're going to lose control completely. So we have to get the herd immunity up high enough before we start pulling back everything. So again, those are things you might have to really reinforce to your staff as they start getting vaccinated, that, we're really excited we got vaccinated, but we still have a ways to go before we can, celebrate 100%. Where is the PowerPoint for the presentation? So for District 10, and I've miscommunicated in the past, 2 of my health departments email them out and post them, 1 posts them. So for District 10, Janine posts them right after this. It's on dhd10.org/coronavirus. And if you scroll down the page, there is it's about halfway down, there's a big blue box and there's a subsection that says information for schools. And right at the top of that, she puts everything that's new. And she usually has it in bold and labels it as new. So later today, or if not later today, then early tomorrow, and Janine, you can correct me if I'm lying, because I don't want to give them wrong information. You'll be able to find the PowerPoint and then the data tables up at that site, rather than emailing them to you guys, because we know that we don't always have all your email addresses. And then for my other 2 health departments, typically they do email them out and then also post them, although the posting might be a little bit later. So I'm sorry that there's different processes, but one way or another, you'll get them or find them or have them. Does that sound right, Janine?
You got it, Dr. Morse.
Phew.
Yep, that's correct.
Only took me 4 months, but I got there. So question about Gordon going to the Biden team. What does that mean for Michigan? I have no idea. I don't even know, what I'm doing this afternoon, let alone what's going to happen. So we'll just roll with the punches. Have there been any changes to travel restrictions for travel outside of the country? They're all on the CDC. It still states that travel to level 3 countries should stay home for 7 days and have a negative test, or stay home for 10 days if they don't get tested. And Mexico is a level 3 country. And so, again, you can go to the CDC and it'll have all that information. I just got a little caught up because the next one says our medical director recommends 90 days. So Bob, I'm not sure what that means.
Our medical doctor.
Oh,
Yeah.
90 days.
My wife had gone in for a follow-up appointment because we had both had it back in October. And he said, do not get your vaccine till at least 90 days from your positive test. We're like,
Okay.
oh, okay.
Well, just so you know, that is, what I had on my PowerPoint was exactly what the CDC says. So there's no evidence that you can't get it within 90 days. It's just saying that since you probably won't get infected within 90 days, you probably are safe waiting 90 days.
And that
So-
could be what he meant, but it's not what he said. But I'm
Right.
good. Just tell me when I can go get my shot. I'm ready to go.
So, okay. Our dental office is able to provide a face mask medical exemption for a student. I guess that's your call on that one. Previously, the state has said it's someone who is certified to make that decision. So, you know, if they're saying that because of the structure of that individual's mouth, they can't wear a mask, you know, I would say that they're probably qualified to make that decision.
Dr. Morse, just
Yeah.
specifically, it was because it causes some rash on the skin.
Okay.
Nothing to do with the structure of the mouth, and it was a letter not signed by a dentist, but a stamp from the dental office.
Yep. So I would say, since that provider is not an expert in dermatology or skin problems, that would be out of their scope of practice. So it would need to come from a medical doctor.
Yeah, we gave the parent our form and said you're going to need that from a medical professional outside of the dental office.
Yep. Yeah. So that's, as long as it's within their scope of practice, I would say it's acceptable. But again, you know, skin care and skin conditions are not within dental care scope of practice. So
that's what I thought. Thank you.
Perfect. Are there currently any studies about the transmission of the vaccine through breast milk? So it is considered to be most likely safe in lactation. So again, there's not been studies on it, but it is not a live vaccine. So you can't transmit the virus through breast milk from the vaccine because it isn't a virus. And there is good information about that on the website. And same with pregnancy. It's considered that it probably is safe in pregnancy, but there really hasn't been able to be studies yet. But because it's not a live or whole virus, but again, they're still waiting to do studies. So women that are pregnant and in a high-risk group should consider, you know, what's best for them on a case-by-case basis. But again, there's information about that on the CDC website that you can read into further. Is the question about vaccination site related to general public clinics or school employee clinics? I guess I don't know what that means, Penny. Is that for the questionnaire?
Yes, I was just wondering, when we sent the link to all of our superintendents about filling out that form, whether or not they wanted to be a site to have a clinic. Did that mean that clinic was intended to be, if they agreed to have a clinic in their school, was that clinic intended to be for school employees only or as a general population clinic?
My hunch would be a general population clinic. If anyone from MID is on the call, if you want to pipe in, again, that would be one of those things I would probably just leave blank and maybe clarify more with whoever calls you.
Okay. I
Yeah,
can work.
this is Marcus. I thought Haley was on the call. She might have had to drop off. I didn't fill out the questionnaire, Penny. I'm pretty sure she meant for the school personnel.
Okay. For school personnel, I will work with Haley on that because just so we have all of our logistics we're clear on everything. So I would like to make sure that we all understand so we can plan accordingly. So I'll give Haley a call and we'll work through it. Thank you, Marcus.
The next one says Phase 1B includes pre-K through 12 teachers. It's actually all school staff, correct? I believe so. All that are forward-facing, not those that are working from home. But anyone on the call who knows any different from me, let me know because it keeps changing.
Yeah, I copied and pasted that from the Michigan Department of Health and Human Services press release yesterday, and that's how they had it worded. I know previously it was a little more specific, so I assume that it is staff that are forward-facing and potentially have close contact with students or other people.
Yeah. I'm just looking. Yeah, teachers, support staff. That's right from the CDC website. So yes, support staff. And I wouldn't forget the bus drivers and those types of individuals. So sorry, this has been a very fast process. So again, with the forms and the emails and everything, we apologize if, words are missing or things aren't as clear as they could be because it has been extremely quickly done. Nuevo Ressa staff have been successful with the link that Sarah sent out. Okay, good. If an employee gets a vaccine and comes down with symptoms within the next few days, for example, severe headache, do they quarantine or just assume it's side effects? So that is a bummer, I know. Unfortunately, you kind of have to assume that it could be COVID. Because, so if they have symptoms of COVID, even if they just got their vaccine, they could have been infected with COVID 2 days before they got their vaccine and just now becoming symptomatic. So again, you need to follow all the same guidelines. So that's why if it's possible, having people vaccinated on a Friday is great, or having people vaccinated before they have a day or two off. Most side effects are worse the first couple of days after vaccination. So anyway, I know that is challenging. For the majority of people, it is just discomfort at the site of the injection. Maybe a headache, maybe some body aches. And again, if it's just those types of things with no fever or other symptoms, I would not consider those alone to be consistent with COVID symptoms. So I think I got to the end of the questions. Again, I appreciate your patience and understanding. We know you all have family members as well, and our registration for vaccination, for the most part, is all online. And so if you have friends or family who want to know how to sign up, that's how we're directing them right now, simply because our phone lines can't keep up with it. I'll open up. Anyone has any questions who's on the phone, if you want to ask those now, or type any others in, go ahead. The other thing, we've heard that there might be some new guidance coming out for schools, just in terms of opening schools and keeping schools open. Excuse me, we don't know much more than that, but we'll share. I was hoping it'd be out before this call, but we'll share it as soon as we get it. I'm sure it'll go to you probably before us. but we've heard it's will be very useful, that it does not really focus on community numbers or anything like that. So, but we don't know much more than that. All right. Well, if there's no other questions, yeah.
I'm really sorry. I just had one quick question with the Moderna vaccine. They talked about a little bit like having to do it in increments of 10. Do we have to have like 50, or if we have 73 staff members at the school sign up, is that okay?
No, you do whatever you need to do. If we have some left, we'll call, we'll call some other group, or we'll find a way to use it, but we're not going to deny you or anything if it's an odd number.
Okay. Okay. We were wondering if it had to be 70, or if we had 73, we had to make it 80 or something like that. So just wanted to make sure.
Yeah.
Okay. Thank you.
Yeah. Thanks for thinking of us like that, though. That's very considerate.
Well, we have to, right?
Yeah. We're a team.
That's right. But we have, okay, so we're thinking that if we have a number of 73, it gives that chance of people saying, hey, we have 7 vaccines left, this is your time to make that chance, or if not, we just wanted to make sure we weren't just including somebody, or, what we had to do for you guys. So good luck, and thanks for all your hard work. And
yeah, thank you. So if you have 7 people that are on the fence and you want to lie to them and say it has to be a clean 80, then you can certainly tell them it has to be an even 10.
We can do our best. No worries.
All right, guys, if you have any other questions, feel free to shoot an email. Otherwise, we'll talk with you next Thursday. If your meeting invite has expired, it's just the same call in as always. Have a good day.